Hello and welcome to your first training for the Women's Health Study. Today I'm going to be walking you through step-by-step how to recruit participants and how to successfully become a research associate and part of the Women's Health Study team. So before we start today, I want to briefly go through what you should have in front of you before you begin this training. You should be connected to the internet so that you can access the online database for the study. You should also have in front of you a training binder that has the study standard operating procedures as well as some of the other forms and important documents related to the study. And you should also have a Ziploc bag that is full of both forms and collection materials for recruiting a participant for the initial assessment. And we call this the initial assessment packet when we're talking about that Ziploc bag throughout the presentation. If at any time you need to stop or pause, you can just hit the pause button on this video and it will stop so that you can practice using the database on your own, or if you need to get up. The video is just meant for you to be able to understand what you're supposed to do as part of the study. When you get to the end, you probably won't know every single little detail, but we're happy to help you with that at the UNC team after you complete watching the video training. You'll have many more opportunities to practice after you watch this video. So today I'm just going to give a brief overview. I'm going to go over the pieces of the initial assessment and give you a chance to practice those. I'll talk a little bit about the follow-up assessments as well later on during the training. So the first thing that you should know is that today, again, we'll be going through the Women's Health Study database, which is where we collect all of the data for the Women's Health Study. And so you can use this database as a one-stop shop for entering data, collecting data, and basically a place to walk you through how to collect information for the study. You shouldn't have to have anything else in front of you while you're talking with a participant. The database will kind of walk you through step by step what you need to know, and I'll talk about that a little bit later on in the presentation. You were recently sent a link to this database as well as a username and password that you can use to access the database both now during this training and also when you're beginning to complete recruitment for participants. So in the training binder that's in front of you, I just want to talk about that briefly. Again, that has several documents in it, but the most important document that you'll use for this study is the standard operating procedures, which is found in the second tab behind the contact information for the study. And the standard operating procedures are a kind of living, breathing document that has all the instructions, step by step, everything you need to know about the study. The way that it's designed is that it has a table of contents that you can look in the table of contents and find any information that you might need to know, kind of like a frequently asked questions on a website. But the point is that this should give you every piece of information you need to know to successfully recruit and follow up with participants in the study. So it gives you step-by-step instructions, kind of like a cookbook, and the goal of this document is to make sure that across study sites we're carrying out the protocol consistently. So you might be in Albuquerque and someone else is in Detroit, but you are all doing everything exactly the same so that we know that the study standard operating procedures, everybody's getting the same interaction. As an RA, you'll have several different activities that you'll be participating in on a regular basis. So one of the biggest is that you'll be recruiting and screening participants for the study. So taking call when a person presents for care at a SANE clinic, and you may be part of a call schedule that comes in to recruit participants. Another important job will be explaining the study and consenting the participants using the procedures in the standard operating procedure, and we'll go over that later today. You'll also be collecting and storing blood samples during the initial assessment. So even if you're not phlebotomy trained, you may not be actually collecting the samples, but it will be up to you to teach the staff in the hospital or at the clinic where the samples need to go and how they're labeled, and you'll sort of be the leader in that part of the process. You may also be contacting participants who are due for follow-up assessments, and you'll definitely be calling them at least once, possibly more for the later follow-ups, just depending on your role. But follow-up is part of the duties of a research assistant. You'll also probably be scheduling appointments for follow-up, and communicating with UNC about any issues that come up as part of the study. And then one time only, you'll be asked to complete a required research training through the city program, and you'll receive more instructions about that, or you may have already received instructions about that. But it's just a set of modules that every person that ever participates in research has to complete, just to make sure that everyone knows how to protect human subjects and what the rules are regarding research. You may also be helping complete data extraction, so pulling information out of the medical record and putting it into the study database, or shipping blood samples to UNC. So I want to talk about the study timeline a little bit. So the initial assessment is what we'll mainly be focusing on during today's training, but the way that the study works is that there's an initial assessment, then there's an initial phone call, which we'll talk about in a few minutes, and then the participants come back in 1 week, 6 weeks, 6 months, and 1 year after their SANE exam. So the initial assessment, like I said, we'll be focusing a lot on this today, and these are all the steps. Don't worry, they look like a lot, but it's really not that many, and most of them are pretty simple. So we'll go through this today step by step so you understand all the pieces. Before we go through all of the steps of the initial assessment, though, I want to talk a little bit about the terms that we use so that everybody's on the same page. So the first part of the study is the SANE screening, and this portion is when the SANE, the providing SANE, so the person who's providing care, actually determines that there might be a patient in the clinic right now that's eligible for the study. And we'll talk about eligibility criteria in a few minutes, but what I want to make sure is clear is that this is not the SANE approaching the participant. This is just them kind of going through the different criteria in their head and trying to figure out, is this person eligible? Is this person ineligible? And that happens pretty close to the beginning of when the person presents for care. Then there's a full screening process. So this screening is when the research associate, or you, confirms the eligibility of the participant by asking them the screening questions. And we'll talk about that again in a few minutes, but just for you to be aware, there is a two-step process. The nurse who's there will sort of do a pre-screening, and then you will make sure that the person is eligible for the study once you get there. And that happens shortly after you approach the potential participant. Then there's an initial consent process. And during that first visit, the exam visit, the research associate is just going to obtain permission to draw blood, access the person's medical record, do a short questionnaire with the participant, and then call them in a few days to tell them more about the study. So today, we're not even asking if we can store their blood. We're just asking to draw the blood, not to do anything with it, and ask them a few questions. So it's a very low impact at this point, and it's designed that way because we don't want to, when someone's in a vulnerable time, like at the time of the SANE exam, we don't want to overload them or burden them with the study. And this happens once you know that the patient is eligible for the study. After that, there's a phone call that happens 48 hours to 72 hours later, and this is when the research associate who saw the person in the clinic, so let's say you see someone on Monday, on Wednesday you would give them a call and explain the full study and try to set up a 1-week follow-up with them. And you don't actually have to be the person that does the 1-week follow-up. You can tell them that someone else will be calling them to schedule, but you'll be the one making the first contact with them just because they've already talked with you, they're comfortable with you, and we want you to be the one to have the first contact. And then finally, there's a full consent process. So once the participant signs the second consent form, or the full consent, they're considered, a potential participant is now considered a full participant for the next year, and they agree to all aspects of the study, and they sign the full informed consent and the blood storage consent, which we'll talk about in a little bit. But basically, at this point, they've completed all of the consents and they know everything about the study, and they will have agreed to everything at this point. And that happens during the 1-week assessment. So they don't complete the full consent until 1 week after the SANE exam. So this picture, which is also in your training binder, just shows the enrollment process a little bit and exactly what is entailed. And so if you go for all the way from the SANE screening all the way up to the full consent, there are 5 steps in the enrollment process of the study. All right, so let's back up a little bit now that we've talked a little bit about terms. The SANE screening, again, this is when the providing SANE assesses for eligibility based on the available information that they have. So they're not approaching the participant about the study at this point. They're just asking if they, or they're just talking about and thinking about whether the person's eligible. And they will ask one question if they think that the person's eligible, which is whether they can be approached about the study by an RA. So the providing SANE will never approach the participant about the study or ask the participant to participate in the study. That will be left up to the RA. And just because of that, we want the providing SANE to contact you as early in the process as possible so that the person's not stuck waiting after their exam for a long time. So this is just an example so you can see that the providing SANE will use this poster or this sort of this cheat sheet flowchart to decide whether a person is eligible. And so the various eligibility criteria are in the big blue rectangle box. And you can see on the right-hand side, if you answer yes to all those questions, then the SANE will approach that person. And if not, if an answer to any of those questions is no, they won't call you. And this is just trying to sort of keep you from being called when the person was never going to be eligible in the first place. If the person is ineligible and the providing SANE finds that out, there's just a simple form that they'll fill out, even if the person is immediately ineligible. So there's something, really clear that makes the person ineligible, like they're under age 18 or they're male. The providing SANE will leave that form for the coordinator to be entered later and fill it out for every single person. Unless, of course, the person is eligible for the study, and you'll document that later. So this is just an example of that form that they'll fill out. All right, so that's the SANE screening. You're already through one step. And the next step is the approach and introduction. And so during the introduction, so the SANE has introduced you to the person, and you'll tell them your name, and you'll ask them if you can talk to them for a few minutes about a study. And then you'll talk to them about 2 things. One is the initial phone call that you'll make to them, and you'll ask them if it's okay if we call them in a few days. And then the next thing that you'll ask them is whether they would agree to a blood draw, because we don't want you to waste any more time. We don't want you to get to the end of the screening and then find out all of a sudden that they're not willing to provide a blood sample. So we ask that up front just to make sure. And if they are willing, then we'll go ahead and screen. One thing that you can talk about with regard to the blood sample, because usually people have questions, there's a script, and this is in the database as well, which I'll show you in just a minute. But if you decide, or if the person is deciding whether to participate, you can kind of give them this script and talk with them about what we'll use the blood for. And this is supposed to be very basic without going into a lot of detail, because again, we don't want to overburden them with information. This script is very simple and just talks to them about what we'll do with the blood. And remember, the first assessment, they're not agreeing for us to use their blood or store their blood or really do anything. The sample will be destroyed if they decide not to come back for the 1-week assessment. So it's a pretty low risk decision at this point.